Morning, everyone. Hope everyone had a good weekend and is ready to be almost midweek. Welcome to the March meeting of the Boston Health Careers Consortium. Today, we're going to cover three main topics. We're going to hear from Greg Bunn, who's the Executive Director of Mass Hire South Metro Southwest Workforce Board. He's going to give us an update on the migrant shelters. We've actually been working closely with Greg, so I'm looking forward to hearing his updates. We'll also welcome Joe McLaughlin of the Boston PIC to provide an overview of the updated regional planning blueprint and healthcare labor market information. And then we'll have an opportunity to share your perspectives and provide some feedback on that blueprint. We're going to meet Adam Cutler and Tommy Hevron of Commonwealth Corporation to hear updates on the Workforce Competitive Trust Fund. Before we get to that, I'd like to, do we have Kalia?
I don't think so yet. So maybe
All right, we're
Vic,
gonna
you can
mix
do
that
your
one up
announcement
then.
first.
All right, so I'm going to come back to Clea and just let you guys know some work that MGB's been doing. You might have heard in the newspapers and such that we're working with Bloomberg Philanthropies to try to, and Edward M.K. Kennedy Academy, working with our clinical leaders and our education leaders and the education leaders at Boston Public Schools, as well as the PIC and EMK, obviously, to create 5 pathways for young people. These are the 5 pathways here: nursing, surgery, medical imaging, medical lab science, emergency services. Emergency service was mostly working with Boston EMS. We do have some people that we do employ in emergency services, and we may do some of that experience, but generally it's going to be Boston EMS for that. These 4 pathways are choices for young people. They're not a given. The idea is that we will, over the next 5 years, double the size of Edward M. Kennedy Academy from 400 to 800 students. They will merge their 2 campuses into one larger one at a new location, TBD. And again, we have pathways that go from, very entry to up higher, and individuals can get on and off whatever they'd like to. And we also understand that some may start this and decide they want to be, architects, which is also fine. It's the idea of, presenting healthcare careers and hoping that they join us, and they'll all end up with a credential. They're going to do dual enrollment with some of our local colleges. We're working with various community colleges, as well as certainly Bunker Hill and UMass Boston. And the concept will be that they will get a credential fairly early on, maybe 11th grade, so that they can start working in more entry-level careers in assistive roles, and then continue to be mentored and come in and have more experiences when they're in 11th and 12th grade. And then when they graduate, they'll either go directly to college, or they'll stay with us and maybe work part-time and go to college, or they'll stay with us in a role that they choose. And then, consider being coached and move up from there. So again, these are suggestions for them. They're opportunities for them. It's certainly not going to be, it doesn't end with this, but it's giving them 4 solid pathways in areas that they may do very well in a career. So we're starting it this fall. And some of them will be coming to us this summer for summer jobs, which they always do, but we're going to try to increase that. And then it's going to go for the next 5 years and then beyond that, because the idea, of course, is that we'll sustain it. So wish us luck. We'll see how that goes. You'll note that there's going to be a couple of jobs associated with this. One of them has already been posted through the consortium, which is the program director for the role. We're starting some interviews on that now, and then that director will choose a project manager that will work with them, as well as multiple other people within our institutions. So that's the overview. I don't know if anyone has any questions or anything, but I'm happy to go into more depth if you'd like to at any other time. You can feel free to call me or contact me, but that's what's going on.
I'm so excited about this. This was, as Kristen knows, the vision 20 years ago, that the employer engagement would be fully integrated with the high school strategy, at least at one school, if not many more. I think this is going to have an influence across the district. I often say there's short-term, midterm, and long-term on workforce. Short-term is HR, 3 to 6 months. Midterm is mostly what we talk about at the Healthcare Careers consortium, and then high school is long-term, but this is accelerated long-term. The expectation is that these young men and women will be qualified for positions that go wanting otherwise when they graduate from high school as part of their post-secondary education plan. This is the future, I think. So MJ, thank you for leading from the workforce side. You know, it's always hard to balance the school side and the workforce side in any of these projects, and thank God you're there.
Well, it's also being handled a lot through our community health group. They're doing a lot of the leadership, so it's a big collaboration with a lot of people. So thanks,
Right.
Neil.
And both you and Claire Pierre sit on the council, so you know this is all one thing from the PIC's point of view.
Excellent. MJ, Talia hasn't been able to join yet, so at the end, if they've joined, I will circle back, so
All
we
right.
can keep it going
Moving
on
into
to
Greg.
Greg.
All right, so I'd like to welcome again Greg Bunn, Executive Director of Mass High's Metro Southwest Workforce. And he's going to give us an update on the migrant shelters and the different initiatives that are happening in that space. Thank you, Greg.
Much for having me on this. So in order to give a little context and background, just want to explain how some of the funding became available for this initiative. About several months ago, there was a supplemental budget passed that allowed $2 million to be moved over from Commonwealth Corporation's Workforce Competitiveness Trust Fund over to Secretary Jones' discretion. And she took the initiative to release that money to all the 16 workforce boards to do what they can to help some of the migrant families in these emergency assistance shelters find unemployment and begin to move towards self-sufficiency. So a couple of things that we propose in our region, our workforce board region is fairly large. We have 43 cities and towns we cover. We cover the Newton, Waltham, Brookline area, sort of just south of Boston, all the way down to Foxborough. So we had just under $270,000 to work on this project. So I had worked fairly closely with Lauren Lele over at Newton Wellesley Hospital, and we'd been bouncing ideas around on how we can help migrant families even before this money became available. So immediately I reached out to her as soon as we got word of this funding. She was gracious enough to connect me with MJ, and MJ had already been working with JVS, Jewish Vocational Service, on a potential pilot. The three entities came together, and for sort of our urban region up in the Waltham, Newton, Brookline area, we are going to focus on a pilot to try to get roughly 45 individuals within the shelters prepared, the individuals who are work ready to prepare to take hospital jobs in the Mass General Brigham network and other hospitals as well. So initially what we're going to do is target right away 10 individuals who in these shelters who are assessed, have work authorization, and are ready to go. Language, there are some individuals where language isn't a primary barrier. These folks, what we want to do is just facilitate labor exchange as quickly as possible, support them through the application process, the onboarding process, and provide post-placement support as well. Beyond that, we want to assess roughly 50 individuals who do need language support and put them, JVS is going to provide contextualized ESOL language services that are related to work in the hospital industry. So of those 50 individuals, we're hoping at least 35 of them graduate the program. And after those individuals do, we're going to provide those same services. We're going to help with all aspects of getting them the application process done with the hospitals, all the onboarding, help them with the paperwork, and then maintain that post-placement support and follow-up service as well. We're targeting the Waltham shelters. At first, there's close to, combined with the Waltham shelters, there are close to 75 individuals who have work authorization, with another 25 who have their work authorization application pending in the pipeline. We're focusing on those individuals first, just because there's greater access to public transportation. That's one of the major barriers that we're running into it, just shelters. There's actually three. There's the ESOL issue, there's the transportation issue, and then there's the childcare issue. So we're going to focus on those areas first. We are working with some of our workforce boards who are in part of the mass hire network too. MGB has got a very extensive hospital network. They've done a lot of great work with Salem Hospital as well. And we've come to learn that there is a shelter in Salem that's actually being moved it was over at Salem State. That building has been bought, and so these individuals are going to be homeless soon. So we may shift and try to work with our other workforce boards to provide the biggest set of services to the folks who are most in need. But that's our first pilot that we're going to work on. Any questions on that before I go into the second pilot that we're looking at? Joanne, looks like you get your hand up.
Less a question than a comment.
Yeah.
We've been involved in a lot of these conversations, and this is the first I'm hearing about this pilot, but BILH will be very interested, and we have identified hospitals that are interested in placing people.
Yeah, that would be great. The challenge with this money is we didn't get a lot of heads up on the funding, and the challenge is too, we have to have all this money spent by the end of the fiscal year. So to this day, I don't even have that money in my hands, and we're looking at March. So I have March, April, June, to March, April, May, and June to get this money spent. What we're hoping is that there'll be through the governor's budget going into fiscal year 25, there'll be additional funds. So yeah, so if this model works, we would love to scale it up to some of the other hospitals in the region as well.
Well, we'd love to be involved in this iteration as well.
Yeah.
In the pilot.
Yep. Go ahead, MJ.
So I also, just another comment, and so great, Joanne, good news, because there's plenty of work in this to go around. We also matched MGB matched the contribution to from the state to get this pilot going. And so we will be doing more significant work in Salem as well at the same time. I just wanted to say that this sounds like a nice thing to do. And we thought, well, we'll drag our managers over to the shelter at Salem and see if we can beg them to hire somebody. And in fact, they went over there and they come out of there like, we want them all. We want to hire every single person in there. They're all go-getters. They all want to work. They hired 6 off the bat. They're working. They're doing great. There was one profile that I know in the paper, and there's going to be like a little TV spot, I think, soon, because they're just doing really well. We had one guy that came from finance in Haiti, and he was willing to take an EVS job, but we're like, all right, how do we get him into finance? Like, how do we move him from there already? So the 6 that they took are doing phenomenal. And the only concern we had, to be honest, was once the managers met this group of people who were like, can we work 7 days a week? We want to work overtime. We want to work really hard. The worry was, would they be ostracized with the people that were already kind of settled into their jobs, that hadn't kind of had their pace and their flow? And would they come in and be like, tell them to slow their roll because they're going to put people to shame? That's how it went. So it's been a really good thing for our managers, and they're pushing their leaders to just open up more roles, because we have to overhire a little bit to make this work, because there's so many of them. That's why, Joanne, please come on in. They're well over 100, maybe 200 with work authorization in the Salem shelter, and they're everywhere. And I know you have Beverly. So anybody that can hire them, good, because there's plenty of individuals that need jobs. So the kind of jobs, Candace asked the question. Right now, we tried to go with the low barrier to entry jobs. We started with EVS, and they were very interested in doing it like that. Some are already, after like 3 weeks, one of them's already in a specialized area like ICU, somebody's in the ED. So they just really picked up very quickly, very smart people. And so we're also looking to expand it, obviously, to some other lower barrier roles. Lower barrier meaning lower language barrier roles. So we're trying to put folks where the supervisors speak their language. A lot of it's Haitian Creole, and so we're thinking dietary, transport, most of the support roles, but also finding ways to path them up because they come from different backgrounds and different levels of education, and working with JVS on language and others to try to make sure that they can maximize their opportunities with us.
Yeah. So, and MJ's help has been fantastic. This partnership has allowed us really to leverage these funds to a greater extent than we would be able to if we were just a sole recipient of this. So we're looking forward to kicking off that pilot. And so a second initiative that we're working on, we are dovetailing with our behavioral health grant that we just received in conjunction with the Boston PIC and the Mass Hire Metro Metro North region as part of our regional planning efforts. We were just awarded $1.4 million to provide training for entry-level behavioral health oriented community health workers. And we're also looking to train in our second and third year of the cohorts, individuals who have a bachelor's degree and put them through a pipeline where they can actually receive their bachelor's degree in counseling and then eventually become licensed mental health clinicians. So that's a 3-year effort. So really on our second pilot, what we want to do is dovetail and try to integrate some of the shelter residents into that grant. So what we're looking at is a cohort of 10 individuals from the shelters in our region to go through the training. The training is provided by 2 providers. One is the Center for Health Impact, and they're out of Worcester. Then the other training provider is the Community Workforce Institute in Training. They are doing, CWI is doing a hybrid model in Waltham towards the end of September. The in-person training for Worcester is with Center for Health Impact. But the idea is to combine that with ESOL training as well to get at least 10 individuals through this training and then trained as community behavioral health workers. So they can hopefully they can begin to even connect with some of the shelter coordinators in the region, whether it's Elliot or Lion, some of the other individuals here, and actually provide services to the populations that they're from at these shelters as well. So it's a smaller cohort because we're actually putting them through more intensive training. At the same time, we are bringing in a shelter coordinator from Worcester, an individual by the name of Faith Bertrand. She is from the Worcester area. She speaks Haitian Creole. One of the challenges that we have had is really getting a consensus of the information from all the different shelters. Sometimes we get some updated information piecemeal here and there, but the communication's been poor. Sometimes shelters are moving back and forth. Some of the individuals are moving out. So Faith is going to come on board and do several things. One, she's going to go through all the different shelters and really get a consensus of who the individuals are there, really what they want to do for work. At the same time, she is going to help us coordinate regional shelter meeting with all the shelter coordinators. So what we can do is make shelter coordinators aware of all the job opportunities and all the training opportunities that we are launching from these initiatives. That way, everybody's on the same page. We also are going to share the pool of employers that we're working on who are interested in hiring these individuals. And that's really the third component of the grant. We are using the remainder of the money to dedicate business service unit staff to go out and work with employers who are interested in hiring these populations, and then facilitate labor exchange based on what those employers are looking for, and then based on the interests and aptitude of the individuals in those shelters. So really kind of a threefold project. The work that we're doing with MGB up in the Waltham, Newton, Brookline area. And then the second piece of it is down here more in the Marlboro area in terms of training community behavioral health workers. And then the third piece is using that business service support to outreach to employers to create a pool of employers who are willing to hire individuals once they have their work ready or their work authorization and they have all their work readiness barriers addressed. So I see some questions. Joanne, you have another question?
I just wanted to mention your new behavioral health grant, the first round you had a limit as to who you could work with, and you could not work with hospital systems. necessarily in behavioral health, but my understanding is that has changed, right? And
Yes.
who you can work with is broader now, and hospitals can work with you on the behavioral health stuff.
Yeah, absolutely. You're correct. So really the first iteration of this grant, we weren't even able to really do we didn't do train in place. Basically what we were doing is trying to create a larger pipeline of licensed clinicians. So what we did in that first grant is work with clinicians who had completed their coursework, either in a bachelor's level or a master's level, and then reimbursed the clinicians who were supervising those individuals as they move towards licensure. So we really didn't do much train in place in that one. But you're right, that was really limited. Commonwealth Corporation really wanted to focus on small behavioral health organizations. But this round is entirely different. So really, this is more of your traditional train in place. So anybody who needs individuals from this grant, we're more than happy to provide you all the information and make all the referrals once people complete the program. So we are getting into recruitment mode for that, and I think Carrie Sandberg, our Healthcare Works manager, program manager, is on the call. So Carrie, I don't know if you want to say a couple words too about the program, the behavioral health program in general while we're here.
Sure, thanks. And I can also put the flyer in the chat. We are actively recruiting individuals who have an interest in community health work and also are interested in working in the behavioral health field. So the area that we can recruit from is really quite large. So anything you can do to help us get the word out would be greatly appreciated. We start May 7th. For a 6-week training for these individuals. And once they graduate, we will facilitate interviews and resume and whatever they need. So we're going to do some case management as well with these individuals so that they are work ready when they come through the 6 weeks program.
And if folks want, just to give you a sense of the scope or the size of the individuals in some of these shelters, I can share my screen briefly. And Ashley, I'm happy to send this to you if you want, if this would be helpful for the rest of the group. But this is the most recent overall census from some of the shelters that we're seeing. So this is basically the name of the shelter, the number of individuals who have been assessed. The green column are those individuals who have work authorization, and then the lighter salmon colored column are folks who are in the pipeline, so to speak. So in Boston, there's several. There's about 37 at Charles River, another 11 at South Bay, Dorchester. Some of the other areas that we are seeing in our neck of the woods, actually, I'll scroll down. I highlighted some of them. Fair amount where unfortunately we just don't have the scope and capacity to work with all the individuals. So in our region, like I said, we cover all the way down to down to Foxbury. So you can see there's quite a number there as well. But again, like I said, these numbers have been updated for Waltham. They're actually higher than that now. They're like I said, closer to 75. But I'm happy to share this with the group instead of read through every column here. But so this is how we're trying to figure out how we deploy some of the funds and some of the resources from this supplemental shelter money. I have a feeling that there's going to be more money released to continue this work, but really this is a first step, and happy to answer any questions. Great. If there's no more questions, I'll turn it back to you, Ashley.
Okay, just a comment if you don't mind.
Sure.
As Angela can tell you, I've spent a little while trying to not get my head around this issue. I no longer have that luxury. My spouse, a semi-retired BPS early childhood educator, volunteers twice a week at the South Bay Marriott. So the scale of this is something we're going to have to get our head around as an opportunity from a workforce perspective. But we now have the Melnia Cass Recreation Center in Boston, and we're about to have the Fort Point facility open up. So this is becoming a big part of our work and a huge part of our chartering effort with the new career centers.
Absolutely. Thanks for adding that, Neil. And thank you so much, Greg and Carrie, for your time today and sharing the incredible progress, and also, you know, showing that this is the beginning of really a long journey working to support many folks coming to Massachusetts. So I'd like to take this opportunity to pivot us to our next speaker. I'd like to invite Joe McLaughlin, Director of Research and Strategy for the Boston Private Industry Council, to walk us through some of the healthcare labor market updates and the new iteration of the Greater Boston Regional Blueprint. Then we'll have the opportunity to move into a larger discussion. So please get those questions and comments ready. Welcome, Joe, and thank you for being here today.
Thank you, Kristen. Greg, I see you also have the Mass Hire headphones, so glad to be partnering with you here on this. So glad to be here. As Kristen mentioned, we're sharing an update on the overall labor market, and part of the reason why we're doing this is to kind of inform our regional planning, which this group has been a key part of over the last several years. So today I'll update kind of where we stand on that, and we'll look at some occupations at the end and hopefully kind of start the process to get some feedback from the group on where we're headed in this kind of next phase of regional planning. So just as a quick recap, when we did this 7 years ago, there are 7 regions across the state. The process was really led by the Workforce Skills Cabinet, and they provide data packages to each region. And then we had almost like a year-long planning process in Boston. And one of the things we had to do was pick 2 at very high level, 2-digit industry sectors that would be our key industry priorities. We picked healthcare and social assistance and professional and technical services. In the healthcare space, it was really more healthcare than social assistance at the time. And you'll see that we really honed in on sub-BA level occupations. And the idea was that there was a lot of coordination work we could do with training providers, community colleges, four-year colleges, and employers around creating stronger pathways in some of these mid-skill occupations that really paid quite high, that pay relatively high wages in the region. On the professional and technical side, the focus was a little bit more on the occupational track, and the idea was that we have all this very high demand when you look at job postings at the time for computer and math professionals, particularly software development at the time. That still continues today. So we wanted to identify how we pathways from high school and then for adults into these fields as well. So today we'll focus on the healthcare. But just kind of wanted to show everyone kind of how we started this project. And the other thing too is that when in the slides today, we've in the healthcare and social assistance industry, has going to become a broad. We're looking more into the social assistance industry to identify all healthcare jobs. And there's 2 areas. One is a lot of our direct care workers are providing services to elderly and people with disabilities. Our personal care aid program lives in the social assistance industry. And then as Greg just finished, a lot of our behavioral workforce is also in social assistance. So kind of having this broader view actually makes sense to assess the true state of healthcare in Greater Boston and Massachusetts. So just as a high level summary, we've been on this very strong employment growth ride since the pandemic shutdown ended in the spring of 2020, where we've been gaining back and surpassed the jobs we had prior to the pandemic. And so employment's been very strong. Obviously, we've had labor supply shortages along the way, which we'll touch on in a little bit. And what's really led us over this period has been the professional and technical services industry, which includes our law firms, architectural firms, life science research, accounting, professional services, and then our healthcare and social assistance industries has been adding jobs, and in education, particularly higher education, have led the private sector growth, with life science and hospitals kind of key contributors within in these sectors. And then within healthcare, the healthcare side of the social assistance has really grown a lot over the last 4 years, while employment and social assistance is still a little bit below its pre-pandemic levels, which is a bit of a reversal. So we'll look more at that shift when we look at that industry in a couple minutes. So here's our line graph of employment over the last 22 years. If you took the axis and titles off of this and and just showed me the line graph. I was like, that's the story of Massachusetts employment over the last 23 years. It'd be my own ink block test. I could wrote papers all along this curve along the way. But when you go back to 2000, we had early 2001, we had 3.4 million jobs in the state. And then we hit that .com bust and recession, and you see employment fell sharply in Massachusetts. Massachusetts was hurt more than the rest of the country. And then we began to slowly climb back, but never quite got back to where we were in 2001. And then the financial crisis and Great Recession hit, and we fell back down. So that first part of this chart, at the time we were writing and afterwards, we kind of called this like the lost decade of employment in Mass, because we ended the decade with fewer jobs than we started. And then we went on this long run in the recovery from the Great Recession, 10 years of really strong employment growth right up through early 2020, before the COVID pandemic began. And around 2015, 2016, we obviously surpassed where we were before the Great Recession, surpassed the 2000 peaks, and the labor market became very, very tight. And we started to see shortages in the direct care space in particular that we address in this group. We've continued to grow, and then recently we obviously had the COVID pandemic, employment losses, and then have had this very sharp recovery. And now we're even beyond where we were as a state back in 2019. So when we're out there hiring and doing these things, it's pretty clear why we're having such trouble. It's because we have a lot more jobs, and we've had this major disruption where a lot of workers have left the workforce for retirement, for other reasons, and it's been hard to, and labor supply has been slow into the state, both from foreign immigration and net domestic migration. So it's very difficult to find workers. And that's kind of the context of what we've seen. Now, if you focus on that first kind of run up after the Great Recession, this chart shows what happened across industry sectors. And professional and technical services, healthcare have led the way. Healthcare and social assistance with about 30,000 job increase just from 2013 to 2019, right before the pandemic. And then accommodation, food services, construction grew strongly as well. Almost every sector had growth over this time period because it was such a big run up in employment, with the exception of manufacturing. We actually were still lost manufacturing jobs over this key period. And then when you drill in to healthcare and social assistance, a lot of the growth was in the home care and outpatient setting. So we had a shift in the industry over this time period, which many of you are aware of, particularly with the Chapter 224 legislation that kind of helped contribute to a lot of the employment growing outside of hospitals. And even though hospitals still grew here, but you'll see that among our hospitals, they're up about 4,900 jobs from this 6 or 7 year period. But there's strong growth across other key industries within healthcare. So assisted living, residential mental health facilities, and then offices of physicians, home health care services, home health aides were one of the top posted jobs around this time period. And then we also had growth among our social assistance sector. So individual and family services includes our services to elderly and disabled, and that's where a lot of our PCA employment is. So the personal care attendant job that's funded through Mass Health lives in Massachusetts. So we had this shift where a lot of the employment was growing outside of facilities and into outpatient areas and care at the home. And then looking at the more recent period over the last 4 years, so from this recovery from where we were just before the COVID job losses to where we are now, with the most recent data available from the state, you'll see that professional and technical services and healthcare are still growing. The employment growth is the highest for those two sectors. Educational services is a little bit behind healthcare at third, and then about almost half, or a little bit more than half of the key major sectors are still below where we were back in 2019. So on that first line graph that I showed the V, they haven't gone back up to the top. We're still below, and that includes manufacturing, accommodation, food services, retail, trade. Of course, we had a lot of closures in those industries, so there's fewer establishments, and employment hasn't quite recovered across the entire greater Boston region. Now within healthcare, this is where one of the shifts are. So on that, from that 2013 to 2019 period, I was showing that individual and family services, which is a lot of our personal care aid employment, was the kind of the driving sector there. Now hospitals are back on top. So hospitals grew about 6,000 jobs over this time period. Still strong growth among physicians, dentists, outpatient care centers, and assisted living as well. But hospitals really has kind of dominated the overall growth in the region. It's within this sector, it's about 65% or 2 out of every 3 of the net job growth over this time period. And then you'll see on the social assistance side and some of the home care settings we've had, we're still below where we were. So nursing care facilities are down quite a bit. Of course, there's been a lot of closures of nursing homes. Individual and family services is negative. Home health services is actually negative as well. So we've had flat growth or negative growth in a lot of these areas. So quite a substantial shift in terms of where we've been generating jobs over the last 4 years in the recovery from the pandemic. So what has happened here? So we know that demand for services, particularly in the home settings and outpatient settings, has not declined. We have an aging population. We've had increased incidence of this disability along with that, and still kind of dealing with this industry shift to move things to the outpatient setting. But what we've experienced is that pretty substantial labor supply issues in a lot of these opportunities. So as I mentioned before, back in 2016, we started to experience some shortages in the direct care workforce in particular. Our home health aid employment actually we were growing very robustly from 2010 to 2016, and then kind of just stopped. And a lot of employers in that space noted that it was just becoming increasingly hard to hire workers. And one of the reasons is that workers at a home health aid can easily work as a PCA, so they can move over to that program. They could also just go work in a combination of food services or retail establishments, because a lot of the skill sets are very similar. They're entry level. They could transition over. So it had become very hard to find workers in this space. We also have had a slowdown in foreign immigration and domestic migration. Coming around after 2016. So we had fewer workers coming in. And then during COVID, a lot of this was really exacerbated because we had huge retirements that reflected that we had to replace workers in, and workers leaving the workforce to care for adults and children as well. And then kind of these long running issues that we have in our state around affordable childcare, transportation, housing. So these all affected. So it wasn't that demand just stopped. It became very hard to fill the employment need at kind of the market wages in this area. So that's kind of an overview of this shift that's pretty unique where over the last 12 years in terms of like where we've been generating a lot of our employment in the healthcare sector. Now, one of our tasks in this group is to identify occupations that we want to prioritize for our regional plan. And as I mentioned in the past, we had looked at the mid-skill health fields. I think there's still opportunity to do that now. But one of the things we've done is we use the state's regional occupational explorer to identify occupations that are projected to be in demand and undersupplied through 2030 based on some of the data sources that they have. And I'll just take you through kind of 4 or 5 of these slides, and then we can have a little discussion and around what your experiences are here. So as a quick recap, our criteria for this is to look at demand and supply, wages and annual earnings, and then feedback from employers, both on individual interviews and then group settings like this to kind of get an understanding of the labor. Because the state will say its labor tool is really a proxy. These measures aren't terrific, especially when you get to smaller occupations. So we really need kind of intelligence from the field to guide this effort. And then there's additional factors that we care about. So one of the things with regional planning is we've had strong commitment from our public community college partners, Mass Bay, Bunker Hill, Roxbury and Middlesex as well, and then Framingham State as well on the 4-year side, and others have been at the table. So we want to identify pathways that the colleges can kind of help support trained workers in through 2 or 4-year paths. And the idea is that we want to tackle some long-term needs as well. So a lot of the workforce system focuses on short-term training with our vouchers. This is an opportunity to do some longer-term planning, much like what Greg mentioned around the behavioral health plan. Having a 3-year run allows us to do more than a lot of our individual training with WIOA vouchers. And then we want to advance the work of this group too. So we didn't necessarily want to do something totally new. We wanted to kind of support what's happening in this space. So we've identified 6 kind of key occupational groups for this group to review. And most of these are accessible without a BA. The one kind of that is not totally is the RN, but there's paths to that from LPN to RN and maybe CNA all the way up through RN. So we have nursing, diagnostic related technicians and technologists, the support technicians and technologists, surge techs, psychiatric technologists. We include the EMT paramedic occupational roles, and then healthcare support, our nursing assistants, medical equipment preparers, a lot of our direct care workers there. But we note that we want those to be along a pathway. And then the group that we've added for this time is counselors and social workers, our behavioral healthcare occupations. So our community healthcare worker, and then also substance abuse counselors and mental health counselors as well, to kind of be considered for additional pathways. So our goal to kind of identify maybe 1 to 2, maybe we could do more for further planning and goal setting. So here are some pretty detailed tables that kind of show, at least I think the main thing is kind of focusing on the earnings for these occupations on this slide. But I'll explain quickly what we mean by openings and completions and supply gap as well. So the first set are nursing occupations. So we have RNs and licensed practical and vocational nurses. And you'll see that for the RNs, in the annual openings from our state projections through 2030 are about 3,100. Annual completions are 3,591. So this is one of the few occupations, well, I think there's only 2 on this table that will show that we are oversupplying RNs, which is why I say to take all of the state data tool with a grain of salt, because these tools are really just proxy. So I think what's happening here is the state's probably underestimating the true need for nurses in the openings category, particularly with replacement demand. And then we're counting all the BA completions in the state, even though a lot of the people that earn BAs in the state will go outside the state. But our supply gap there we're not showing a supply gap there, but we certainly are among the second occupation there, the practical and vocational nurse field, where they're estimating about 400 shortage. Now, our diagnostic related technicians, this is kind of the mid-skill technical roles that we identified last time. There's a set of 4 here. I won't read through them because I think a lot of the groups are very familiar with these roles. Clinical lab technicians did not make the list, but I think it's something that we could also group here. And I know it is a focus of the new EMK school. I saw it on your slide, MJ. So I think that's something that we could, that should be added to discussion as well. And then we have the next set are generally more lower paying roles, but require less education in general. And this is a support technologist, technician roles, dietetic, surgical techs. And then we also have our emergency medical technicians and paramedics, which we've done some work in Boston around pre-apprenticeship and apprenticeship into those programs. And then medical records and health information technologists. And then 2 last groups are healthcare support or direct care workers, and also medical transcriptionists as well. So this is a group, again, a little bit lower educational requirements to get in. They require some post-secondary in most cases, but pay near or close to median wages relative to their education level in the state, and could be thought of as along a pathway to higher level jobs. You'll see the nursing assistants and medical assistants in our data show up as pretty huge shortages on an annual basis as well, which is always a reason why we're kind of thinking about how we create more pathways into those roles and allow workers to climb the career path within the healthcare field. And then last main slide here is in the behavioral health space. So we've identified a few here using the state's data tool. As I mentioned, some of these occupations would fall within social assistance, some would fall within healthcare, and of course some would fall like outside in other industries as well. But these are areas where we show some pretty big supply gaps as well, particularly with the social and human service assistants and the substance abuse counselors in the state's latest estimates. And many of these, the first three are accessible without a BA. The bottom two generally require a BA, but there's new paths being created into some of these roles. So I know that was a lot of detail on the tables. I've been doing this a long time. It's kind of hard to show some of this information without kind of having the earnings and supply ratios along with it. But so as just kind of a recap, I think one of these among these occupations, all of them are in demand. And I mean, when you look at any kind of industry projections, because we're getting older as a state and as a region, so it's likely that demand will keep increasing in this space. In addition to that, we've had severe labor shortages in some of these areas for a while. Those are projected to continue, barring major changes, but we have low birth rates in the state. We're kind of reaching our peak high school graduation this year. So for about the next decade or more, we expect smaller cohorts of young adults entering either college and workforce training programs to kind of fill some of these roles. And then immigration, both domestic is generally still negative because of some of the high cost of housing in the state and other and lower growth. And then, of course, foreign immigration can swing quite a bit back and forth, where we were very low for a while, but with the development in terms of migrants, we've increased there over this past year, which kind of holds some opportunity for increasing our labor supply for some of these roles. But that is subject to future political developments in terms of what will happen to foreign immigration in the state. I see a few people smiling. I know today's primary day, and presidential outcomes will have a major impact on this, because the Trump administration, when they came in, obviously we had foreign immigration slowed quite a bit, even what happens with a Democratic president could change given the issues around the border. So all these things affect our labor supply. The summary point here is that it's hard to imagine a point where these things would be heavily oversupplied. So I think there's a lot of opportunity for us to create pathways for workers into these roles, and many of them pay really good wages for community college educations and associate degrees. So it creates a lot of economic mobility within Greater Boston. So there's a lot of good things that we can do, and obviously it takes care of our aging population as well, which is something that's increasingly important. I noted one of the things that is, in terms of the structural barriers we face, you'll see that in my earlier slides, childcare employment was growing quite a bit when we were on that run from 2013 to 2019. Of course, we were adding jobs. People were coming into the labor force. They needed more childcare. So the firms are growing. With the pandemic, a lot of these places shut down and closed, and we had these reductions. And that's one of the things that affects our workforce there as well. So if we have adults staying home with their children and also taking care of elderly parents, it really affects us how we're going to grow in any other sector in the economy, whether it be life sciences, financial services, or so it's really kind of like a crucial need for Massachusetts to figure out how we can better care for elderly at home, grow our childcare so that we can have enough workers to kind of fill all of our industry sector needs. There's some dire projections from economists in this space about what's going to happen over the next several years as more of our baby boomers age into years where they'll need more long-term care, and how we're going to kind of supply those needs. But that's a wrap there. I think we could open it up. I'll turn it back to Kristen and Ashley, and I'll stop sharing these slides in case we have time for discussion, And the last thing I'll say is we might try to do a little poll after this, after this meeting to kind of get some feedback from training providers and employers specific in some of these areas. So thank you, Kristen.
That would be great. Thank you so much, Joe. That was fantastic, uplifting, but also a good reality of where we are right now in Massachusetts. So just looking at time, we have about 6 minutes here. We have a time for probably 1 to 3 questions, depending on complexity. All right, Joanne, going right to you. Love it.
I'm a fast talker, so I want to make 2 points. I think I'm glad you're looking at nursing. I think we all need to look at nursing in this region. I didn't see associate degrees, and I think that's a really important part of our Boston ecosystem. So I'd love for us to kind of play that out a little bit more. And we're all, you know, I think that's a nice step on the career pathway to becoming a BSN, and many of us are much more open to hiring them. So thinking about that. And then my other comment is, did we look at respiratory techs as a need, and where did that come out? That's the one thing I saw that was maybe missing.
Sure. On the nursing, the LPNs, I was kind of surprised in the state tool, they just say some post-secondary, but I really think it as like an associate degree. So, and it should be, I think, right?
An LPN is different from an associate degree nurse, is kind of the same as a bachelor's nurse. So it's 3 different levels.
Okay. So we could explore that more, but I think that was sort of what I was thinking, is that it was one and the same, but I didn't quite understand that nuance. So no, certainly associate degree pathways I think are key, and that's kind of, the state's kind of opened back that back up from several years ago where it looked like we were going BA for art. And so and then respiratory therapists, it's very small numbers in the state, but certainly we're showing it's undersupplied, so we can add that back in. I remember we thought about that back in 2017, and we just thought it was too small. And little did we know that there'd be this respiratory virus that would skyrocket demand for so happy to add that one back in.
Thanks.
Yeah, so Joe, we do have a question in the chat talking about the 6,000 job growth in hospital settings. Do we know what specific occupations are increasing in demand in hospital settings specifically, and what factors are contributing to those increases?
Sure. I think I don't have exact answers, but we know from the postings that nursing is in very high demand. I think it's contributing to the growth, even though a lot of the hiring is in like the replacement space because of retirements. But I think that the nursing workforce are growing. I'd be curious to see what the employers in the room say. And then a range of managerial positions as well. So medical and health service managers, and then direct care workers too. So, I mean, one of these, like, hospital demand has increased. We also know that specialty hospital employment has grown pretty rapidly too. So that's not included in that 6,000, because that's really Boston specific and not for the whole region. But I would say in general, it's been across the board, but certainly nursing, managerial positions, and then growth in our specialty hospitals because of rising demand, which is across a range of occupations. But others feel free that are hiring to chime in there.
Yeah, one thing I would just add to that is I think there are roles that we've developed through the pandemic that we didn't have before. Some of that, I think a lot about our behavioral health needs at Boston Children's have just changed so much with the pediatric behavioral health crisis that happened, or that is happening, but really spiked. So that really changed sort of our structure within that space and the needs that we have, just as one example. I think we have time for maybe one more question. Or Joe, if you had any questions for us, or are you going to follow up with the poll to get some additional feedback?
Yeah, I think we could do that. I mean, one of the things we'd like to know is just of this set, which one should we kind of hone in on, which ones would benefit the most from a regional planning process of convening training providers, colleges, employers, to identify like how can we kind of create more opportunities in this pathway and better prepare adults for roles here. And so happy to, if anybody has any kind of parting comments on where to kind of direct some energy, happy to hear that.
Final thoughts? Thank you so much for this. I know we'll be posting the slides, but also took some pictures because it's really interesting to see these numbers and where we are and how we can use this information to bring back to on the employer side, but also on the community-based organization side, the higher ed side. So we really appreciate your time today. Thank you so much, Joe.
Okay, thanks everyone. Glad to
Thank
be here
you.
and look forward to working with you on this new plan going forward.
Us too. All right, so we're going to switch gears again, and we'd like to welcome Adam Cutler and Tommy Haverin from Commonwealth Corporation. Adam is the director of the Workforce Competitiveness Trust Fund, and Tommy is the senior program manager. So they're going to share some new updates about the WCTF funding. So welcome, Adam and Tommy. Thank you.
Thank you very much, Kristen. Thank you very much, MJ and Ashley, for inviting us here today for this opportunity. It's great. Some of you haven't seen in many years. It's great to see you again. And some of you I just saw yesterday in a Mass Workforce Association. So the first half of this presentation you might have heard just yesterday, but the second half will be new to you. So thank you for that. My name is Adam Cutler. I'm the director of the Workforce Competitiveness Trust Fund at the Commonwealth Corporation. I've been in this role for about 6 months now. And prior to this, the last decade, I was in the community college system where I finished off as a dean at North Shore Community College. So today we're going to talk to you about some of the opportunities for funding, specifically for healthcare, but we're going to talk in general about Workforce Competitiveness Trust Fund funds. So just a quick snapshot that beyond WCTF, there are other funding opportunities at Commonwealth Corporation. So I know you're going to get these slides later, but if you're interested in any of those beyond WCTF, happy to make a connection if you're not already aware. And various ones here do fund training programs within healthcare. And we recognize that there is not a lot of public funding opportunities specifically for healthcare outside of what ComCore offers. So we are doing a lot in that area, but we could be doing more. So, but that's all due to public funding. So we're hoping to in the future be able to increase some of those fund lines, and I'll show you that in a second. Right now, there are 3 major grants under the umbrella of the WCTF. The first is the Donnelly Success Grant, which was rebranded a few years ago after late Senator Donnelly, and that's what we'll be concentrating on the next few slides. The second is the Healthcare Behavioral Health Hubs, which I know all the workforce boards are very familiar with. As just a couple of weeks ago, we announced almost $17 million of awards to all 9 workforce boards in this area. Tommy, in a second, we'll talk more about that. And then finally, we have the Scale Grant. Scale Grant was originally intended to be for pre-existing programs to help scale up. And we're actually going to rebrand that in the coming month. We're about to re-release both of these RFPs. The main WCTF Donnelly grant, you should see that in the next few weeks, so to hopefully get to all of your inboxes. And we've updated some of the content. We've tried to streamline some of it, make it more clear, make it more accessible in a lot of ways, both accessible in terms of opportunities to get that funding, but also in terms of the way it's been presented. It was, when I first took over this role, it was almost a 50-page tome that was incredibly challenging to get through. And so we really streamlined that. It's not about 25 pages, but didn't lose any content. And the second one's going to be the WCTF Program Design Grant. And what that's going to be is it's a grant that you can literally, if you're not ready for to go for the big grant just yet, it'll give you some seed money to do some planning and some program design. So it'll be up to 6 months and $50,000, and that's intended as a precursor with attached with quality technical assistance to help bridge that gap, so you can apply for the big WCTF Donnelly grant. So those should be coming out, just pending some final approvals over the next couple of weeks. And then our next review periods will be late April, maybe even early May. We're setting those exact dates. But happy to take questions on any of that in just a minute. But we are going to be, obviously, we're going to continue working with all opportunities, all proposals. But we're going to be emphasizing our targeted outreach to the following areas you see here. So anything involving workplace learning, apprenticeships, internships, etc. Adult ed specifically. So we just heard a lot about the needs for language learning and vocational language learning specifically. We just started a community of practice specifically for programs that want to develop an English for Employment program or a vocational English program, and prospective applicants within that. So we can help you design those kind of proposals that are directed towards a specific industry. And really, we want to focus on new arrivals and shelter-based populations, but even beyond that. So any way that we can do that. And one way that we have been able to do that, so clearly one of the main outcomes of a workforce competitiveness grant, participation in it, is a job, a solid job outcome, and that's how we measure. So what that means is that you do need to have your employment authorization in order to get a job as it stands today. But going on the impetus of the shelter-based families, which are now being quote unquote fast-tracked, so between 1 and 6 months, they'll get their work authorization. We can now work with those individuals. So if you can demonstrate that you are on track to get your work authorization, and then in theory, by the time you finish, you'll be able to apply for that job and hopefully get that job. So we've been able to do that across the board, so that more and more populations can now participate. So it's not reaching 100% everyone, but it's opening the door to a lot more people in that respect. So hopefully a good step in the right direction in that respect. A little overview of the funding history and funding availability. So WCTF has existed since 2006. So you can see 2006 is at the bottom of this bar graph. And it's been a line item in the state budget ever since. So you can see that it started off with relatively small numbers, $1, $2, $3, $4, $5 million every year. So in the beginning, it was very competitive, and there wasn't a lot. There was less than 10 probably every year grantees that received awards. But then during the pandemic, it really escalated. We received tens of millions of dollars from ARPA, the federal level, as well as on the state level. So the last since 2021, we have over $70 million that have gone into this fund. We have awarded much of that ARPA-based money at this point, which is great. But we do have almost $20 million left that are left to be awarded. So that's what we can award over the next couple of years. So there's a lot of opportunity there. But it is a marked decrease, as you can see, over the pandemic. So during the pandemic, we were able to start funding and going into industry sectors to which we hadn't gone to before. So historically, healthcare has been about 50% and probably will remain so in terms of the sectors that we've been able to serve. But we were able to reach into new sectors we hadn't before: early child education, construction, life sciences, etc. And also expand what we're doing in the healthcare. And Tommy will talk in a minute about the healthcare hubs specifically. So we've been able to enjoy that, but we are also exploring ways to bring in new funds and new ways into the WCTF, so that we can continue this great work 2 or 3 years down the line once these grants ultimately expire. We were able to work with almost any entity within the Commonwealth. From colleges, we work with just about every college in the state, community college in the state, some privates, for-profit, nonprofits, community-based organizations, every industry, and of course, all the workforce boards and mass hires have, in some shape or form, have a current grant with the WCTF. Just a 30,000-foot overview of the salient requirements for a WCTF grant. You must have an MOU with at least 2 employer partners, at least. And in those MOUs, the employer partners detailing that they have jobs available and that they'll consider your graduates, your trainees after completion. There is a 30% match as well. So if your awards were $300,000, there would be a $100,000 match on the lead grantee side. So the state looks at it as actually a $400,000 award in that respect. We work with unemployed workers, and at least a 75% placement outcome needs to be achieved. And the truth is that most of our grantees surpass that. Some of the organizations in this room have well surpassed that have received WCTF grants. If it is an incumbent worker, and we do work with incumbent workers as well, they would have a promotion, new job, and a wage gain, and then of course 30 days retention within that. And then the wage gain would be $2 an hour for more. We're working on that $2 an hour piece. So we've definitely heard from our constituents that can be challenging. So stay tuned on that one. And of course, it's highly recommended to work with a partner with a mass hire on your project. And I would say about 50% of the projects do have a partnership with the mass hire. And finally, I mentioned a little bit about community practice. These kind of went away for a little bit during the pandemic, but now they're back and strong and really important. So now we work with grantee partners from the Cape to the Berkshires, and we're getting together quarterly, either virtually or in person, and really exchanging those best practices and really understanding how we can work best together. So I'm going to pause here for a second before I hand it off to Tommy, if there's any general questions or comments on WCTF before we get into the healthcare specific bit.
Yeah, there was
MJ,
one
please.
question.
Oh, Kristen,
Yeah.
sorry.
No, I was just going to read MJ's question. Will there be salary or stipend support for work-based learning?
Yes, I love that question. So something is developing. It is percolating. I don't have all the information ready for public release just yet, but the EOWD did set aside a selection of funds out of ARPA specifically for this purpose, to be able to provide stipends outside of the grant. So if you have a current grant, healthcare-based grant with WCTF or CTI, as the case may be, the Career Technical Initiative, there will be an opportunity to have some money on top of what you already have, specifically for stipends. And it's going to be significant. So stay tuned. It's not ready for public release yet, but probably within a month, I'll be able to, any current grantee partner will be able to give out that information, but it's huge. It's really, so thank you for asking that question, MJ.
There's also a question about how to join a community of practice.
Excellent, good. So we actually have two parallel community practices going on right now. One is for our current grantees. So if you're a current grantee, you probably would have already gotten a notice for that. If you haven't, please let us know, and we'll definitely get you into that mix. And the second is for grantees that are, or I should say prospective grantees that are interested in applying for a WCTF grant and specifically want to work with ESOL or limited English populations. So we do have a working group for that as well. And if you're interested in either, you're welcome to reach out to me. I know Ashley will share my slides, and probably my contact information will be part of that as well. So some good opportunities there. And in general, I'm happy to set up time with anybody individually and just talk about these issues and challenges and how WCTF or other opportunities could address them.
So Adam very skillfully preempted the $2 an hour wage increase requirement. I was surprised on the Workforce Board Directors meeting that was such a big issue.
It was.
Is that a barrier for using WCTF in the healthcare space?
It can be today. So right now it is policy. So I'm working today on or currently on trying to update that policy.
Adam, what I'm saying is, as a fan of wage increases, and our board is very focused on, are we getting wage increases for our invested dollars? That rise. I wasn't going to speak up, I don't need to be in the minority in the Workforce Board Association, but I'm just wondering if it's an issue for us in the healthcare employers on the call.
So I think we all agree we want to give pay increases to all the individuals. I'm sure that's the case, but in some industries, in some companies, some organizations, that can be really challenging. So what we're looking for is some alternatives to the $2 an hour wage gain. Somehow where the employer can have that quote unquote stake in the game in that respect. So we're working on alternatives that will work for everybody, but that's the current policy, but actively working on it.
Got it.
And I think it's also important to point out that the majority of the WCTF grants that have gone towards healthcare have been for underemployed, unemployed workers, which is great. But just to make everybody aware that WCTF can also serve incumbent workers to help upskill current employees. Just to put that out there as well. Go ahead, Tommy.
Thanks, Adam. Got him. Yep. Good morning, everybody. Thanks so much again to to the consortium for having us today, and happy to talk about the healthcare specific work that we're doing. And I'll talk a lot about the healthcare behavioral health hub continuation grant impact that we're having. As you can see here on this slide, 31.7 million since 2021 has been obligated and prioritized for healthcare, which is a very significant amount of the money that we've been managing. So definitely a priority sector for ComCore and for our state. Happy to be responsive to that. Here I just counted them. There's 75 partners listed here. So these are training providers, these are employer partners. Many of these overlap in the healthcare behavioral health hub grant, but some of them are also in many of our other healthcare projects. There's overlap for WCTF and HCBH hubs as well. But just to give you a snapshot of the statewide capture that these grants are having and our ability to be partnering with key employers on here. Many of them are listed on this table that are in this call, all the way from Berkshire to the Cape. So it's really great to see lots of great partners who are supporting this work and contributing to our system. To give a bit of a snapshot of the types of occupations that we're training for, again, with unemployed and underemployed focus and some incumbent workers. Some of these have been talked about today, the community health worker work in Metro Southwest, serving the greater region, as well as the licensed mental health counselor work as well. I know Boston PIC is focusing on surgical technician, but these are some other occupations of focus that are being reached across the state. And nice to see this coming after Joe's great presentation on occupational demands in Greater Boston. I think you can see it kind of reflects the statewide reach too. But these are some of the heavy hitters that we're seeing in funding with our projects now. I'm now happy to give a couple of program highlights from the past couple of years. And I'm grateful Greg was able to talk about and Carrie was able to talk about their project in Metro Southwest, because that means that we got to hear from a little bit more of a great program highlight. So this is a grant funded with one of the Donnelly grants. This isn't a healthcare hub grant anymore. It was a healthcare hub grant and a behavioral health hub grant in the previous two iterations in the central region. But Open Sky Community Services is a community-based human service provider based in Worcester, serving Greater Worcester. And they developed this human services direct support pipeline project in partnership with Seven Hills Foundation and affiliates, and two community-based organizations called the Southeast Asian Coalition of Central Mass and African Community Education, ACE. And essentially what they were trying to do is bring in workers to fill their entry-level roles in human services. And they're having a very hard time doing that in competition with Seven Hills and other large area employers. And in 2018, 2019, they decided to exchange olive branches and form one large partnership and tackle this challenge together. And that's had an incredible impact and has really taken off ever since. And ComCore has been happy to be supporting their work with the workforce boards and other partners. But essentially, this program has evolved into three unique pathways. One is kind of the pipeline pathway for un- and underemployed individuals. They target primarily BIPOC, immigrant and refugee populations in Greater Worcester. And over a 5-month span are doing rotations of classroom training and on-the-job training. And they're receiving a wage that's paid through another funding source and supplemented in somewhat by the employer's Open Sky and Seven Hills. But they're able to rotate at those different organizations and get experience, then ultimately get employed at the end of the day. And then they said, well, that might not be enough. Let's try to diversify and create more opportunities for these folks to move up in the organization into management and clinician roles. And how do we make those pathways available to them? So they've been developing an incumbent worker advancement pathway. And that's what this grant is helping to fund as well, the WCTF grant that they currently have been awarded. And so they're trying to create those pathways and identify what are the priority pathways that we can send them down that is somewhat standardized and fits the WCTF model of having the advancement outcome at the end of the day. And as Greg mentioned, the partnership with Framingham State University to prepare licensed mental health counselors. They're also receiving some funding from Accelerate the Future and from WCTF to pursue that similar pathway. And so they'll have a cohort or two of those LMHC incumbent worker trainings. So this has been a really exciting project to follow. This project, the Healthcare Behavioral Health Hub Grant, this is the continuation. So to give you another flavor, out in the Berkshires, they're one of the 7 grantee partners or 9 grantee partners of the 7 regions that we'll be working with over the next 3 years, and happy to continue their work. They're Their training pathways range from CNA to acute CNA, medical assistant, and registered behavioral technician. They're partnering with Berkshire Health Systems, the large health system out there, Integritas Healthcare, long-term care, Breen Center, Human Services, and community health programs, also Human Services. This grant also has a planning focus in addition to a training focus. And so the work that they're developing to implement in years 2 and 3 of their healthcare behavioral health continuation grant focuses on developing nurse pathways and also looking into how to better serve the behavioral health career pathways that were supported with the BH grant that didn't necessarily have an advancement outcome at the end of the day. And so they're trying to figure out how to develop advancement outcomes for those workers that might lead to wage gains. One program I wanted to highlight is another kind of work-based learning program with a medical assistant in partnership with Berkshire Medical Systems and Berkshire Community College. And these folks are hired on and as practical assistants, I think is the job title. And they're doing their work in a classroom and working at the Berkshire Medical Systems, or Berkshire Health Systems, I should say, locations, and over a 40-hour week, they're getting their training and their work experience. And at the end of the day, they're being prepared for medical assistant roles. And they've had a lot of success with that model. They enrolled 35 and they were able to retain job placements for 31. So they're happy to replicate that over the next couple of years and continue running those cohorts and expand that model. So the moral of the story is that it seems, if you can support our workforce and in their training and provide a wage and allow them to get that experience on the job, it seems to be sticking to the wall pretty well. And just to echo again, we have great partners here, and we're very grateful to support the regional partnership that the hubs are by nature. Very excited with the Boston PICS surgical technician training and serving the area hospitals, and want to give them a shout out. And we're happy to answer questions either today or by email. You can always reach me, type thevern@comcore.org, or get in touch with me through the workforce boards that are on the call.
Thank you both so much, Adam and Tommy. We do have a few minutes if folks have questions, which I have one that I want to acknowledge. And so for the group, we'll be sure to highlight at another meeting more around the surgical tech initiative that we have in partnership with majority of the hospitals on this call. Now that information isn't embargoed, we're very excited about that initiative and the work that will come from that. And one other piece that has recently come out that Adam or Tommy, I hope you might be able to quickly acknowledge is, especially for Greater Boston, we've had, obviously, the state has Mass Reconnect, and Boston itself has tuition-free community college. So one lingering question that had been in our forefront of our minds was what was the order of operations, if you will, of which funding applied first. And I know that there's been recent decisions on that. So I think if we can just quickly give an overview of that decision, that would be really helpful for the group as they also potentially consider applying for WCTF.
Yeah, so that's great news. There was lots of questions around what is the last source and order of depletion, as Ashley's saying. So essentially, if there's everyone has to meet certain criteria and eligibility for different programs like tuition-free community college or Mass Reconnect, but where those programs apply, and also Pell Grants and other financial aid services that the student may be able to receive if they're at a higher rate institution, those funds should be applied first when you're looking at the total cost, and then WCTF can come in and kind of finish the job. So if it's for 4-credit training programs, if it's a non-credit training program, then WCTF is happy to jump in and cover that. But for something as a surgical technician training that the Boston PIC will run, someone who is Mass Reconnect eligible or Pell eligible, or may receive a state grant or scholarship, I'm just going to say the total cost $15,000. If $10,000 of that is covered through scholarships and grants, then WCTF can cover that last $5,000 and any other training expenses that might be related to that isn't tuition or not covered by those grants. So I like to think of it as, can WCTF be part of the pie? And maybe it's that last slice that you saved for the end of the day. Maybe it's the big slice that you've been waiting for. But thanks, Ashley, for calling that out. And I know there's different scenarios and different case examples that we can run into. And if you ever have a question about that, just feel free to ask us, and we're happy to kind of talk through what that looks like. But definitely, we're happy to get a solid answer on the order of operations. Hopefully that clears up some things for everybody on the call.
think there's a lot of public dollars available, and so that's why the question, and we don't want to compete with those other public dollars. So that's why the order of operations come in. So really spot on to ask that question. Thanks, Ashley.
Thank you both. I don't see anything else in the chat. So as just before we close out, I want to welcome the announcement that was supposed to happen at the top of the meeting. I'd like to welcome Harvard Medical School's Kalia Noel Gibson. They're the program coordinator of the Biomedical Science Careers Program, and here to share a bit more about their upcoming virtual career fair. So Kalia, please unmute.
Yes. Hi, good morning, everyone. I apologize profusely for not being here at the top of the meeting. I'm grateful to you all for sticking around a couple extra minutes. So I am Kalia Noel Gibson, program coordinator for the Biomedical Science Careers Program, better known here as BSCP. We are a 501(c) housed within Harvard Medical School, and our mission is to bring resources, mentorship, information to students and fellows from underrepresented populations about, basically how to get from point A to B when you are majoring in something like, cancer research or oncology, or just if you are on the pre-med track. We have various programs. Our huge program that brings in about 1,500 students biennially is our student conference that happens over at the West End. We started back in 1991, and our conference at the West End has been around since 92. So we just celebrated more than 30 years of our program recently. And so what we have now is a bunch of programming that came about through the pandemic. We needed to still serve the community. So now we do, in the spring, we do a career development series. Everything is virtual. This is our virtual career fair that's coming up May 15th. It is a Wednesday. We use e-poster boards, and so all of the if you've ever seen that interface, it's very visual. It's kind of cute. I would call it cute. Maybe there's a better word for that, but there's a display where there's floors in a building, and there's tables and seats, and basically every table would represent an institution. So the students that come can go and visit your table. And once you visit a table, we're basically in a meeting such as this because they do utilize Zoom. So you would have a representative or 2 or 3, and then you would have 7 or 8 other seats for people that have come to visit your table. And so they're able to get information that you would like to provide about either available jobs or jobs that will become available, or just about the institution that you represent in general, and what they maybe could find there in the way of whether it's like nursing or research. If it's, laboratory based, we have different departments from healthcare institutions in the area. We also have a lot of biopharma that's going to be there. We try to make it diverse because our kids are not just going into, or, our students and fellows are not just going into biopharma and medicine anymore. They've got all of these, niche interests. And so we have like pathology, MGH pathology coming, and, different so it's okay if we have, what I'm trying to say is it's okay if there are multiple areas from the same hospital being represented, if that makes sense. So that is happening May 15th. It is 12 p.m. to 2 p.m. It's just 2 hours. We do have the students start to register April 1st, and they provide their current resumes. A lot of times they don't have to, but they can. And a lot of them do take advantage of that. And what we do with those is just put them in Dropbox and provide a link to the institutions that are coming. So that way, if they come and they say, hey, I gave my resume to BSCP already, or if there is, you know, a conversation that happens, hopefully they provided that and you can go and open their resume in real time if you needed to. So there's that. Trying to think of anything I have not said. BSCP.org is our website. It's very short, BSCP.org. I can place that in the chat. And I am the one that that is putting the virtual career fair together. So you would contact me directly via email. Let me see, I'm gonna put my email in the chat. It's rather long. If you wanted to participate. So I am willing to take any questions. I know this is the end of the meeting and it's quick. But if you have any questions, oh, and it is free to participate. So that's something that I wanted to say as well.
Thank you so much, Kalia. And just to wrap us up, for clarity,
Yes.
the best, so I will be sure to, any details that you have to share with the group, I'll be sure to include in our newsletters, including your email and contact information. And the main ask of your career fair is that you're looking for employers to come join and have different representation from across their systems to table, correct?
Yes, that is correct.
Perfect.
And also I wanted to say, these are people who are, or students and fellows who are either getting ready to graduate college and then through early career as well. We've had more than 350 attendees last year at last year's virtual career fair, up from 200 the previous year. So I'm hoping for more representation this year in both ways, participants as well as institutions willing to table.
Excellent. Thank you so much.
Okay, thank you.
And for sharing, and for everyone, thank you for participating in the meeting. As always, materials will be posted on the website and linked in the newsletter. And otherwise, we will see you on June 5th for our next meeting. I hope everyone has a great rest of their Tuesday. Thank you.